Fellow Nigerians, I am your president. Fellow Nigerians, the coronavirus poses an existential threat to our nation like none we have ever faced before. The official global death toll from the virus as at today is over 1,700 people, and the numbers are rising daily. The coronavirus is 100 times more lethal than the Ebola virus, and it is spreading like wildfire. Over 60 million people have been quarantined around China alone. That is almost the entire population of northern Nigeria. It is estimated that it has hit 28 countries across the world right now. No virus has affected that many countries in such a short time. Daily, the number of diagnosed cases in China increases by 30%, which accounts for just newly admitted cases. The fact remains that the magnitude may be higher than that. From what we know so far, the coronavirus could have a long incubation period, as long as 14 days, and individuals could be contagious while still asymptomatic. That is, individuals are already able to transmit the virus when they haven't started showing known symptoms of the virus infection, which was not the case with SARS in 2003. In some cases, it appears the virus may be aerosolized, which means it doesn't require physical contact for transmission, but just the distance of sitting in the same room. The sad truth is that this virus might already be within our borders. We were caught napping because we didn't understand the dynamics of the spread of this virus. I take responsibility for the failure of my administration in not taking more proactive measures in dealing with this health emergency. The coronavirus has come at a time when we are already grappling with the perennial Lassa fever, which has so far killed an estimated 380 people. Information at my disposal also suggests that our hospital wards are full of children who are suffering from an illness suspected to be caused by a virus born from the Harmattan winds. We all know that our public health institutions are fragile and are not equipped to deal with a major catastrophe like this, and we lack the data to effectively monitor and respond to situations like this. But as your president, today I say enough is enough. We will never be found wanting again. Courage is born from adversity, so we will therefore take bold steps to curtail the impact of this virus and put in place measures that ensure we are never found wanting again. To this end, I have established a command and control center within the presidential villa to monitor developments surrounding the spread of this virus within and outside the shores of this country. I have directed the Ministers of Aviation and Interior to require all international airlines flying to Nigeria to provide detailed advance manifests showing first point of embarkation of all passengers. In the event that any passenger originates from a high-impact area, all passengers on board that flight will be quarantined for a period of 14 days. I have also directed the Minister of Health to provide adequate personnel at all our international airports to screen all passengers arriving in Nigeria. He will also provide emergency numbers and an online portal so that members of the public can provide any information of suspected cases of this virus. All medical personnel will also provide information to government through this portal. All known and suspected cases of the virus will be referred to our nation's university teaching hospitals, so I have directed that all chief medical directors of our teaching hospitals create quarantine zones within their facilities. We are also collaborating with other governments on research to seek an effective vaccine for this virus. In confronting the scourge of this virus, we must also seize this moment to rebuild our healthcare infrastructure. Several years ago, you suffered the indignity of having your president spend almost 6 months in a foreign hospital. That was one of the lowest moments of my presidency. Nigerians spend over $1 billion annually on medical tourism. Surely we need to put a stop to this. My administration will design, build and commission the first 1,000-bed level 3 medical facility in the region within 2 years in each of the 6 geopolitical zones. Within the next 1 year, we will equip and upgrade all government hospitals to international standard. We will embark on a massive retraining of all our medical personnel to equip them with the tools to meet the requirements of modern-day medicine. We will also be embarking on an audit of all Nigerian medical personnel working overseas with a view to attracting them back home. I have also directed that henceforth, no public servant will be approved for foreign medical treatment. The Central Bank of Nigeria will no longer provide foreign exchange for overseas medical trips. My fellow Nigerians, All hands must be on deck as we fight the scourge of this virus and rebuild our nation's healthcare infrastructure. This nation belongs to us all, and united we will succeed. God bless the Federal Republic of Nigeria. God bless you all.